This talk is about clinical applications of cardiovascular CT. Cardiovascular CT use criteria has been defined by ACCF along with multiple other bodies, and they have defined appropriateness criteria. And if these criteria fall between 7 to 9, then that indication is considered appropriate. If it is less than 3, then that is considered inappropriate or like class 3 indication. And if it is between 4 to 6, then that is just borderline case or uncertain indication. So considering these criteria, various indications has been defined. Cardiac CT is of two types. One is the non-contrast calcium score. The other is the CT coronary angiography. Calcium score, we have already talked about. It has got great prognostic value in asymptomatic people, not in symptomatic people. And the different values are associated with various levels of risks. And they can be used as a guidance to the statin therapy. As far as the contrast angiography is concerned, it has got reasonable sensitivity and specificity. But the best thing about CT coronary angiography is that it has got excellent negative predictive value. So this is a very good tool when you need to rule out coronary artery disease. So CT angiography is indicated if you have a patient with chest pain syndrome and there is intermediate likelihood of coronary artery disease. This test is appropriate whether the patient is able to exercise or whether the patient is not able to exercise. This is example of normal coronary angiogram, an abnormal coronary angiogram in patient with intermediate likelihood of coronary artery disease. Then when there is an equivocal stress test, you do ETT test, but it is equivocal, then CT coronary angiography clarifies. And it can rule in or rule out coronary artery disease in these patients. It is an excellent test when you are suspecting coronary anomalies. Sometimes you are not able to engage coronary arteries and the anomaly is the reason. And then CT angiography can define the anomaly in its entirety. A patient with coronary fistula, then if your patient is symptomatic with acute chest pain and the troponins and cardiac enzymes are negative, but still patient has got intermediate likelihood of coronary artery disease, then this test is indicated. This is a patient with normal coronaries presenting with acute chest pain. Then this is very good test for study of the grafts as well as native coronary arteries in patients with post-cabbage symptoms. Then in patients with stent, this test is not very good, but you can use this CT coronary angiography for left main stenting and for stents bigger than 3 mm. But for smaller stents, this test is not very good and you are not able to visualize what is inside the stents. CT coronary angiography can be used for assessment of cardiac function, especially when the information from echocardiography is incomplete. So otherwise, this may be a complementary information in patients undergoing CT coronary angiography. This test is also appropriate in patients with valvular disease, whether it is native valves or prosthetic valves. You can study their stenosis, regurgitation, and valve area, and all the features of the valves. Then this test is also appropriate in patients with suspected cardiac masses. In patients with suspected pericardial conditions like constrictive pericarditis, you can see the rim of pericardial calcification and the other features of constrictive pericarditis. Then this test is indicated in patients with undergoing radiofrequency ablation for atrial fibrillation for defining pulmonary venous anatomy. This test is also indicated in patients with planned biventricular pacing for study of the coronary veins. Then for all aortic conditions, whether it is aneurysm, whether it is dissection, whether it is obstruction, the aortic condition, or in all aortic conditions, CT angiography is a useful investigation as an appropriate indication. In patients with suspected pulmonary embolism, CT angiography is appropriate investigation. In patients with complex congenital heart disease, like this patient with congenitally corrected TGA, CT gives perfect information. In other patients with complex congenital heart disease like anomalous pulmonary veins, ASDs, VSDs, this test is indicated and appropriate. For study of the branch vessels of pulmonary arteries, this test is appropriate. For other complex congenital anomalies like truncus arteriosus, this gives good information and is appropriate test. In patients with big PDA, patients with aortic interruption or coarctation and its complications, patients with total anomalous pulmonary venous drainage of any type, patients with aortopulmonary window, patients with congenital anomalies like Epstein anomaly with right side involvement, patients with pulmonary arteriovenous malformations, this test is appropriate. Okay. So the final word is that cardiovascular CT is a useful investigation covering almost all aspects of cardiovascular disease management. Thank you. Ayub? There is no formula. Actually, this has been defined by experts. I don't know what exact formula they used, but they did a scoring system starting from 0 to 9. And according to those experts, the average value of their scoring was taken as the score for that particular indication. And if it fell then more than, if it was more than 7 to, and between 7 to 9, then that was considered as an appropriate.